Good morning from the annual meeting in San Diego. We're pleased to be here today with Dr. Steve Pflugfelder from Houston. Thanks so much for being with us today.
Oh, it's my pleasure. Thanks for inviting me.
Congratulations, Steve, on giving the Binkhorst Lecture this year. What a terrific honor for you. And I'd like for us to take a few moments to really empower our audience to understand the tear film and why tear film instability is such an important topic and why you've selected that topic for your lecture.
Yeah, I picked that topic because I think that it's a key element in success of all of the surgical procedures that we do, and really even just general patient satisfaction and comfort with contact lens wear. So I think that pretty much all the attendees of ASCRS would be interested in that topic.
Well, I think, Steve, that in the past, ophthalmologists have not really focused too strongly on the tear film, but it's becoming more and more important in our discussions on everyday topics. Why do you think it's become a more prevalent topic for us?
Well, I think patients are more and more interested in getting the best outcomes from their surgery, and doctors are realizing that their surgical techniques are improved, our instruments are better, but there were other factors, including the tear film, that they had to really take into consideration to get the best outcomes.
Yeah, absolutely. It sounds like, as you mentioned in your lecture, that surgeries such as cataract surgery and corneal refractive surgery are very dependent in terms of satisfaction and proper outcome on the stability of the tear film. How do we go about measuring and understanding the tear film and how it may impact various procedures?
Well, I think it's doctors should get into a routine to try to evaluate the tear film, even if it's a fairly simple, few tests that they perform in the office. So I think if they're going to do two things, one would be to put in fluorescein and just quickly evaluate the tear breakup time, the standard fluorescein tear breakup time. And if the tear breakup time is 7 seconds or less, it should be a red flag that maybe that patient has an underlying tear film disorder that they may want to address if they're considering performing premium IOL surgery, particularly multifocal IOLs or LASIK surgery. And then they can also use some of the instruments that they rely on every day, like corneal topography, and actually just look at the placido rings, the spacing and the regularity, or many of the topographers now have a regularity index, and they can take a look at that. If that's irregular, especially if they repeat the exam, then again, that's another warning sign.
I know, Steve, that you mentioned in your lecture that fluorescein has kind of been our old standby for a long time, and there's nothing new in fluorescein, and it's a very useful slit lamp evaluation test. But I understand that you also spoke a little bit about some potential non-invasive ways to evaluate the tear film, especially because fluorescein itself, while it's useful for evaluation, can disrupt the tear film just by administration.
Yeah, that's correct. And I think, as software has improved and image quality is enhanced by better cameras, that we'll be able to detect tear breakup even faster than what we see with fluorescein. So that there may be very subtle changes in the image or the ring quality or smoothness that could be picked up quite early, and maybe there will be new indices that will evolve that say even after 2 or 3 seconds of gazing that we'll start to see early degradation of that and then pick up the tear instability.
Well, that's a really important discussion point. I'd like to shift gears for a moment, Steve, and speak a little bit about treatment, because we know that we have garnered a lot of really great ways to evaluate the tear film, and we're better at it and more recognizing tear film instability. And it seems like there have also been more advanced therapies that have come to light. What are some of your favorite therapies for addressing the tear film? And also, Steve, what do you think we're going to see on the horizon in years to come?
Well, I try to take an approach where I determine what the underlying problem is, at least to the best of my capability, which isn't always great. But I typically stratify dry eye or tear disorders into tear sufficient, which is often meibomian gland disease, or conjunctival chalasis, or tear deficient, which would be aqueous tear deficiency. And then based on the underlying problem, then I'll try to tailor the therapies to that. For the tear sufficient problem, if there's meibomian gland problems, I'm still a fairly big advocate of nutritional therapies, essential fatty acids, including some omega-6s like gamma-linolenic acid and fish oil. I still rely on azithromycin and doxycycline, either orally or topically. And then, there's a variety of thermo flow compression techniques that are available that I do think make patients better, and at least in the short term will improve their tear stability. If it's an aqueous deficiency, then my goal is to try to improve mucus production. Cyclosporin is a well recognized to increase goblet cell number and secretion, and then also to treat the health of the ocular surface epithelium, and corticosteroids are a good way. And I think on the horizon there will actually be corticosteroids that will be approved for treatment of dry eye. There's a number of new therapies in the pipeline. A lot of them have to do with suppressing different types of inflammation, either innate or adaptive inflammation, and I think some of those will definitely add to our armamentarium.
Well, that's a great summary, Steve. I also want to mention that in my own practice in New York, we have a lot of patients who are coming in complaining of difficulty with symptoms when they're working at the computer. And our patients sometimes are on the computer screen 16, 18, 20 hours a day. And they're wondering, what can I do other than turning off my computer screen? What are some ways that I can help improve my tear film? And I think that's a really hard thing to approach. What are some of your thoughts there?
Yeah, digital lifestyle is a huge risk factor for dry eye, and I think it's maybe why there's this explosion of dry eye all of a sudden, even in younger people, that we didn't used to see before, because they're even spending more time on digital devices. I would recommend taking periodic breaks. I would try to maybe position their work area away from direct air drafts, which would be drying, to position their monitors at or below eye level, which minimizes eye opening. And in the worst cases, maybe they might have to get protective glasses with side shields, or even little sponges that would shield their eye from the air drafts.
Well, that's a great recommendation. And Steve, I'm so glad you're able to share your expertise with us today on tear film instability. Congratulations again on the Binkhorst Lecture, and thank you to our audience at home watching live. We appreciate your support. Thank you.
Thank you very much.